Good evening, everyone, and welcome to tonight's town hall. I am so excited to have you guys join us or watching this recording. Tonight we are having our town hall and we will be focusing on healthcare. I am excited to introduce you to Carla Bailey-Smith, who is a candidate for District 88 State Representative. Carla.
Yay, Carla.
Thank you, Kelsey. And thank everybody who's joining us tonight, or if you're watching later on, thank you for taking some time to check us out. This is our third town hall, and the overall theme of my series of town halls is why vote? And the reason for that is that many people do not realize how many decisions are made at the local and state level that affect their lives, our lives, directly. Honestly, it wasn't until after the 2016 election that I started truly understanding all the offices I would see on the ballot. I also didn't understand why we rarely had Democrats running against Republicans. We will have a conversation about that another time, but at the core of it is people being willing to step up and run for office, and understanding why it's important to have people who truly care about the quality of life for their fellow citizens. Tonight, we have two county board candidates from Tazewell County. We're going to show the map so you can see the districts, if you've got that, Kelsey, as they fit inside the state legislative district 88. Tara McKinley is running in District 2, and Paul Resnick is running in District 3. And now, first, I would like to welcome back Paul Resnick, who is running for Tazewell County Board District 3. Paul was with us at my first town hall where we talked about education and connections between the state level of government and higher education. Paul teaches English at Illinois Central College. So welcome back, Paul.
Thank you, Carla.
Yeah, and so Paul, everyone is hyper-focused on healthcare right now. So please tell us about how county board decisions affect healthcare services in Tazewell County.
Well, first of all, thank you, Carla, for inviting me onto your vital program. And I really share your value about voter education and voter information. I think that is so important, especially right now. And I'm so happy that you picked healthcare as the item, and it is the item. We were just talking beforehand about how many weeks now we've been shelter in place. And so this affects all of us. But to get to your question, there is a direct link between the county board and the county health department. The chairman, this is according to the structure, what I read on the Tazewell County website, but the structure basically is the chair of the county board, and right now it's Chair Zimmerman. He appoints the members to the health board. Okay. And not only that, but the Tazewell County Board has what they call a health services committee. And the chair of that is a gentleman, very nice gentleman named Gary Sin. And Gary is also the lone board member on the county health board. So it's composed of physicians and other people in the medical community. I could talk all day about the services of the county health board if you want to know some of the things that they do.
Yes, yes. Go ahead and tell us about what the county health department provides for residents.
Sure. So it's really amazing how many services they provide, and I'm just going to go through this list, and I'm amazed as well. This has been a learning curve for me running for a political office for the first time. But there's so many jobs like supervising animal control, acting as members of the Regional Pollution Control Site Hearing Committee, overseeing this county solid waste management plan. They are big conduits for communication between the mayor's police, fire, businesses, ICC, where I work, superintendents, chambers of commerce, faith-based institutions, long-term care organizations, schools. So they're a big conduit. Anything going on in the name of health in this community, they are a conduit to get that information out to the community. So they have a vital communication link in our community. They also have tons of services and programs. They have something called birth to 5 programs for children, immunizations. The interesting thing about that is when we do get a vaccine for the COVID-19, the county health department would be a big part of those vaccinations.
Okay.
So that's a vital service. There's other things, drug-free schools, community school and women's programs, even dental programs, environmental health and food inspections, food programs, sewage sanitation, green programs. I can keep going. Here's an interesting one right now.
Yeah.
And that is county food pantries.
Okay.
That's a big thing. And the food comes from various sources like the Midwest Food Bank, but the county health department is making sure that health guidelines are followed for these food pantries. So I really admire all of the services that the health department does. And Amy Fox is the director. She's doing an amazing job from what I've heard. And just by this list, it's amazing. They provide healthcare workers classes on what-if situations. So that's interesting. They work with the Emergency Management Agency on situations like how to care for people who need medical treatment and who can't care for themselves, emergency child care for essential workers,
that's good.
Daily updates on Facebook on the COVID. So they really are all over the place, and I'm not sure how they do it, to be honest with you.
That's amazing. So I see that. So I just heard you say that is it the Emergency Management Agency or is it the County Health Department that has the daily COVID updates?
Yeah, so that's the Tazewell County Health Department that has the daily updates on their Facebook page.
Okay.
Excuse me. And now the Emergency Management Agency, from what I gathered from them, is that they do, if there's a natural disaster, if there's an act of terrorism, if there's man-made disasters, then they get involved. And, you were wondering earlier, does a pandemic qualify? And I would say most certainly yes.
Yeah, it does seem like it would.
This is like a natural disaster. So EMA is also, Emergency Management Agency is definitely a part of this. Right.
Okay. All right. So again, connecting the county board to our services. You were telling me about the budget, and I think we have a budget that we can show. So did you want to talk a little bit about how the county board makes decisions about using the tax dollars in Tazewell County?
Well, right below that revenue sheet, and I didn't show you, was the expense sheet, and most of the expenses actually go to personnel. But here's the revenue page, and I think the interesting thing for me about this is how much are based on grants. A $5.6 million budget, and notice only the taxes are about $1 million. So they need 4.6 million, or what does it say here? I'm not sure. I'm not good with the numbers, but most of their money comes from grants, not from the county, and a significant amount of that. So I thought that was very interesting. So
yeah, that is.
They really, for all the services they provide, to rely on grants is kind of a catch as catch can. I mean, good luck with that. What if one of these big numbers don't come through for them, like the Illinois Department of Public Aid? What if that doesn't come through? If one of those doesn't come through, wow, there go a ton of services. So yeah, I was surprised. I don't know. I'm curious to know your reactions to these numbers, but I was surprised at how much of that is just a year by year, well, we'll see kind of thing.
Right, right. Well, the other thing that we wanted to talk about was the pressures that our leaders are facing, our local leaders are facing, because we've got most of our elected officials saying continue shelter in place, but locally we have a vocal few who are trying to open up sooner. So you want to share your view on that with
Yeah,
us?
I mean, this is the hot topic, and I really feel for people because we're hurting right now. We're hurting on a number of levels right now. I just was texting with a good friend of mine today. He works at Caterpillar, you know, a solid job. He was just let go. He doesn't know when he's going to return.
Mm-hmm.
And it's so many levels. It's city, it's county, it's state, it's nation. Woodford County State's attorney today in the paper was sending an email to the sheriff of Woodford County, basically saying, you know, I'm not going to follow these shelter in place. So, and of course, that would be really against the governor, Governor
Mm-hmm.
Pritzker. And, you know, I guess I sympathize with the pressures because you've got to put food on the table and you've got to eat, but yet you've got to be safe. So it seems like, and we don't know the end date. And so all of us are under stress, and we're all, you know, most of us are caught between a rock and a hard place. And Carla and Tara, you guys know as well as anybody that those people who are not as economically in good stable, thank you, are having a lot more difficult time. They have to leave the home. They have to do those things. You know, yes, I'm working hard as a teacher at ICC, but I'm on Zoom and I'm staying home and I'm staying safe. But I really feel for those workers who have to leave the home. So I get it. You know, I get it why there's some, you know, people, luckily they're a minority, saying, okay, we've got to phase out this shelter in place and start phasing in getting out there. But on the other hand, you know, if you don't have your life, what do you have? So I feel for every leader on every level because they're feeling the pressure. And the pressure is, how many more weeks is this going to go on? And how are we going to feed our family? And how are we going to pay our bills? And now it just trickles down to the state, the county, the city. East Peoria just stopped their recycling. And I understand the dilemma there is, do we lay off people or do we stop the recycling? You know, and so these are horrible decisions for our leaders.
Yeah.
But I really like what Dr. Fauci said, and I've seen this a number of times, and that is, and this is a hard one for us to swallow because Americans, I think, aren't really patient people. I'm not a patient person. I want things right now. So, but Dr. Fauci said we have to, the virus basically makes the timeline or sets the timeline. I don't want to take any of Tara's fire away, but if we see it that way, if we don't see it as a political football, you know, Carla, why I love the fact that you're running and Tara as well, is that I think you're willing to listen to the other side. And this should not be a Democrat or Republican issue. It should not be a political football. This is life and death. This is health sciences. You know, you have to believe the sciences. At least, you know, my core is believing the sciences. My dad was a chemist. My wife is a geologist. You know, I'm around scientists. And, you know, we have to believe the science, and we have to let the virus set the timeline.
Right.
So but we also need care and compassion, and we need leaders that are very explicit in sharing the fact that we're going through hard times and that we've got to hold together. And I watched Brooks and Shields on NPR, on television, PBS. And David Brooks was saying, you know, he was so proud of the American people because by far the vast majority are following their state governors and their leaders in shelter in place. So it's sad that this is political. This should not be political. This is science. So.
Right. Oh, thank you for that. Kelsey, are there any questions either in the chat box or on Facebook?
Thanks for asking. Right now we have a couple of viewers over on Facebook, but currently no questions. But we'll go ahead and keep an eye out for those. So if you do have questions, feel free to chat them in Zoom or comment on the Facebook Live. We're monitoring both.
Okay, great. Well, thank you, Paul. And I really appreciate you sharing, your personal passions about these issues. It's really important. So now I would like to introduce Tara McKinley, who is running for Tazewell County Board District 2. So welcome, Tara.
Hi.
And Tara is a registered nurse. So my first question is, are you currently working?
Well, thank you, Carla. And to backtrack just a little bit, Paul, thank you for your impassioned views. I agree with you 100%. And thank you, Carla, for hosting us, and thank you for running. I am not currently working. I am furloughed, but I am one of the fortunate ones in that, I have a job in healthcare. I have sort of an end in sight for at least for my own job. But I've been in it a long time. I've been a nurse for 38 years, and some of that was in the hospital. A lot of it has been in Peoria in an ambulatory surgical setting. So I've got a little bit of variety in my background. I, could go somewhere else if I needed to, but a lot of our constituents and the people out there, they don't have the luxury of making those decisions. So I feel for them.
Right.
Anyway, healthcare itself and being in it for this amount of time really kind of sparked my interest in running for office, bringing some healthcare background to the table kind of gave me a springboard to start looking in my down ballot, looking at different offices to run for. And because of that link between Tazewell County Board to the Tazewell Healthcare Department, I thought that would be a good liaison, a good place to start. So anyway, that's why I'm running, and that's what I'm doing now.
Oh, that's awesome. Thank you for stepping up to run, because as I said before, we need diversity in our legislative leaders. So can you tell us more about, from a nursing point of view and a medical science point of view, about why it's important to phase in our ending shelter in place, starting to open up a little bit.
Right, certainly. It's so important that we do all get back to work. I mean, every day you watch the news, there's something new on there about how different states are responding. I am particularly proud of J.B. Pritzker and his leadership in this, because he has been, a rock throughout. We've kind of gotten some mixed messages from the federal government from time to time. I am a big fan of Dr. Fauci. Paul mentioned him earlier, and he said that the virus will set the timeline, and it has been setting the timeline. So getting through this all together, the things that are most important for us right now, I think, are social distancing. And I agree with wearing masks. I know that's a little bit controversial for some, but I've worked in surgery and wear masks all the time. And it is to protect those around us. But as we go forward and as we think about moving ahead, social distancing, I think, is going to be part of our lives for a long time, whether it's to protect us this fall from the flu, or whether it's to protect us from another round of COVID. Social distancing is probably one of the most important things that we can practice, on a daily basis when we have to be in public.
Right.
The masks start tomorrow. I know we've talked a little bit about that. You hear about all different kinds of masks, N95s and surgical masks should be primarily for those frontline workers, people that are interacting with or dealing with patients or closely to people. A lot of people have been out there making cotton masks, and I've seen some on different websites that you can purchase. I personally have my own cotton mask that one of the nurses made. As you look at masks that are out there for purchase, I do think there are some differences in quality. So if you find a mask that has several layers of tightly woven cotton, I think those are the most protective.
All right.
And then
yeah. So Kelsey, did we have we had a page for masks? Is that something we can put up now and then?
Yes, absolutely.
Okay.
Awesome.
So Tara, you're saying that it's really important to have several layers, right?
Yeah.
In the mask, or like I have one that has a pocket for a filter,
like a coffee filter, maybe. I think that's great. Anything that creates an additional layer adds to the efficacy and effectiveness of that mask. I've read, several different studies, and masks have actually in surgery kind of been one of those sacred cow things that, they've talked about, should we give them up, should we not, for years. But I don't see it happening. There we go.
There we go. Do make sure you can breathe through it. Wear it when you go out in public. Make sure it covers your nose and mouth. And
try not to touch it.
Say that again, Tara.
Try not to touch it. A lot of times you on and you want to touch it or adjust it, or but it's not protective if you touch it, and then later on you're going to take it off and touch your face or glasses. So launder them.
Right. So that's the important thing about the masks, is to make sure. So the other thing that we wanted to talk about, to follow on from social distancing, was the health aspect, and kind of bringing it back to our local services with mental health, because this social distancing, it's been, I counted this morning, it's been 50 days since my son came home from junior high and hasn't been back. It's been 50 days. So that's a long time, and that's starting to affect everybody's mental health. I know, even in I have a husband and a son, and we're a loving, strong family, but if it's your turn to do the dishes, you need to do the dishes, and there might be an explosion over it. That's a mild thing, but there's a lot more serious things that people are feeling, especially people by themselves, or people who might be in physical danger in their own homes. So I know very simply, 211. 211 is a number that you can call and get all kinds of help. And I know we got out of order, Kelsey, threw you off.
Sorry.
But if you have that mental health page, that second page.
Yes, I'm so sorry. I actually shared my wrong screen here.
That was entertaining. I was like, oh, check it out. There's people watching us on Facebook.
Yes, sorry.
Yeah,
I was
this is
interacting on the Facebook.
No, that's good. That's good. I'm asking Kelsey to do quite a lot as host, and I appreciate it. Right. So we've got mental health tips here. I'm going to let you talk about it a little bit, Tara, since you're the nurse and you've got, kind of a medical point of view about this.
Well, I think what you said is very important. It has been 50 days, and we're all facing different stressors, whether you've applied for unemployment insurance and it hasn't come through, whether or not you have healthcare insurance. You might be dealing at home with symptoms of COVID, or taking care of somebody that is. You might have been in the house with small children for a long time. Your home might not have been safe beforehand. I think all of those things are so important to know that there are resources out there for you. Mm-hmm. Somewhere there, Tazewell County does have some numbers. There is that mental health hotline, crisis text line. I know that healthcare dollars, some of them are going specifically to add more time and services to those mental health needs that we might have. Mm-hmm. And the other thing that's super important, I think, is in some way self-care every day. Mm-hmm. Do something, however small it is, for yourself, whether it's, getting outside to walk around the block, socially distanced 6 feet apart from anybody else walking.
Right.
Get out there and ride your bike, or just take some time for yourself, because it's important. If you can't take care of yourself, somebody else might not know how to take care of you. And your 2-year-old isn't usually the best at that. But you need to be able to take care of those around you, and taking that time is important. And it'll keep you healthier as well.
Yeah, right. Right.
Thank you for that, Tara. I was just reading an article in the Peoria Journal-Star about a week ago, and a counselor named Dr. Ted Chapin wrote an article about those very things you're mentioning, Tara, like meditation, or like exercise,
right,
or like try to keep to a daily routine as much as possible. The list went on, but I think that self-care is so important. I like also that on this screen here that you have a lot of phone numbers listed. Tazewell Mental Health Services. There's also a mental health help, call for calm or text, and there was a number 55-2020 for Spanish speakers as well. So right. There's plenty of services out there. We have to get that information out to people, and it has to be available for them. They have to know about it. The Heartland the Heartland Hotline, there's a number for that. So there's all kinds of numbers and services, but I think this is the tip of the iceberg. The other day I was feeling sorry again for a mother who was trying to teach her, help her child learn from Zoom. And it's like third grader, and she has special needs already, but the mother also has all these other pressures. And now she's trying to help her, her child learn on Zoom. And it's just, oh my goodness. So the stress levels are just way up for all different reasons.
Right.
Yeah.
So one other thing that we wanted to discuss a little bit was questions that our viewers or our listeners might be interested in, such as, Tara, do you know if Tazewell County is planning widespread testing to identify positive cases prior to the state beginning phase 1 opening?
After speaking to them today, I was really happy to find out, it sounds like they're in communication. They're talking to the state and the leadership that we've got there. So they're working in alliance. And I think they will have more things out there, more services available as we get closer to phasing in. Right now, Tazewell County isn't offering the drive-through testing. I had the opportunity to take advantage of McLean County's services at the fairground a couple weeks ago. And they were really super easy to get in and out of. The health department recommends going to McLean County to the fairground, going to Peoria has multiple sites available to get testing if you need it. As far as ramping up availability, I think as we move closer to opening things back up again, right now I think every site was limited to 150 tests per day, but hopefully as we get closer to that, our goal of beginning opening, they'll be ramping that up. I know I hear, Pritzker speaking daily of reagents and nasal swabs and the laboratory test. It's not just having the test, it's being able to run the test and to get it completed. So there are multiple things, I think, behind the scenes that have to fall into place. But our county health department has good hands on it, I think. We had talked a little bit about contact tracing, and they've got 5 or 6 people in their epidemiology department. Sorry.
You got it.
And so they're doing contact tracing and, following up on new positives. And I just read an article, I think, earlier today that talked about, across our 50 states, there will probably be a need to ramp that up by, maybe 80,000 people or more to have contact tracing in place for the whole country where we need it to be. But, excuse me, I think they've got a good handle on who they need to talk to and where they can get more help. So in Tazewell, I think they're doing a good job.
Tara, can I ask you a personal question? I woke up with this morning. There's so many questions. Carla, if you don't mind, I woke up this morning, I thought, should we be tested? I mean, none of us have symptoms and we don't know if we're asymptomatic. I mean, what should an average person like me who has had no symptoms, should we get tested too, or are we staying out of the way for everybody else? It's interesting how Peoria opened it up. At first they had very strict guidelines. Then they said anybody. But I mean, what do you recommend for people like me who have been shelter in place, like you guys for 5-6 weeks? Should we get tested or not, or is that just a waste?
I think if you've been careful and you haven't been marching without your mask on and protest or whatever, and you're careful and you don't have any symptoms. I know there's a lot of talk about super carriers, and maybe they are never symptomatic. But we deal with super carriers of other things all the time. And we have to be, careful with hand washing and, exposure. I would say, while there's any kind of need for tests elsewhere, if you're healthy, then no. Unless I think places like the meat packing business, I do think they're probably going to need to be tested, maybe routinely on it, maybe 2 weeks, or any kind of symptom shows up at all. I do think that those people will need to be tested. They work in such close proximity to their neighbors, and they've had so many problems. Nursing homes are another area where maybe getting baseline tests from everybody and a test with some frequency going forward as we have availability of testing. Prisons, that may be another area. I think these are all super potential hot spots that we might not see the impact of what's going on in those places until you've got, a lot of sick people or a lot of people carrying.
Well, Tara, you got my vote. I wish I lived in District 2 so I could vote for you.
Well, thank you, Paul. I vote for you too.
Hey, I wanted to say a couple things though about that, especially with nursing homes, because I live very close to ICC, over by the Generations at Riverview, where there were some COVID cases. And then down the hill is a memory care facility. And then across the field from where I live is Rosewood Nursing Home. And then just east of that is a huge nursing home that they're building. I don't know if they're targeting my neighborhood or what, but we're getting surrounded by the nursing homes. But in all seriousness, I think that's a great idea that everybody in those facilities should be tested first, like the prisons, like their nursing homes. Great point.
And I want to make sure that anybody listening now or watching later understands that the McLean County Drive-In Testing Center and the testing centers in Peoria have opened up specifically for people with no symptoms who are exposed on a regular basis to the public. So that could be any number of jobs where you're engaging with the public and putting yourself in a position where you could be picking it up, whether you're a grocery store worker or even a food delivery person. I would guess, postal workers, anybody who feels, I don't think they're turning people away. Paul has a good point. We shouldn't go just because, I want to know if you don't have, but if you are putting yourself out there every day and potentially exposing yourself, then you have every right to go get tested, and please do so if you want to.
We were talking the other day about other symptoms as well. We talk about a cough and a fever, a low-grade fever, pretty routinely, or shortness of breath. But, some of the other things that, loss of taste, or loss of smell,
COVID toes.
My morning coffee, the COVID toes, or a rash. There are other things as well that body aches. So it's not just limited to it sounds a little more fluish, doesn't the body aches and things like that. But there are other things to watch out for as well. So if you're not feeling well and you think you might have been exposed,
then absolutely go get a test.
Absolutely.
Kelsey, are there any questions on Facebook or just comments? Any comments you want to share with us about our conversation?
Yes. So we did have a question from Facebook from Brittany Miller. In trying to strike a balance between public health and economic well-being, whom do you think elected officials should bring to the table to seek guidance and perspective?
Dr. Fauci.
Okay. Yeah. And Dr. I might not pronounce her name correctly. Enrique, and I think it's Enrique.
Yes.
Who speaks every day at the governor's news conference, and she listed those new symptoms today. And if anybody watching or listening hasn't watched or listened to one of the governor's daily press conferences, if you listen today, or may have been yesterday, she did talk about the added symptoms.
Great. I missed it today.
It was either today or yesterday, but they're all on the governor's website, and if you Google it, you can find them on YouTube. They're all out there. You can find them very easily.
Well, if I could try to answer Brittany's question, because it's a very good question. I like the fact, and I think highly of Governor Pritzker as well. And I like what he said in one of his press conferences a few days ago. He says, look, I'm a businessman, and he made his millions from being a businessman. And he knows the stress that business people are going through right now by not opening up. So to answer Brittany's question, I think that an elected official should bring to the table the economic leaders of the community, with the healthcare people in the community,
Right.
with elected officials in the community. And I like the idea of the phase-in, the gradual phase-in, and the real thoughtfulness that goes into that. Tara mentioned the tracers. Tracers are going to be huge. And I also like the idea of the testing, because the metaphor of testing, I'm an English teacher, so I have to talk about metaphors, but the testing as your eyes about, you have to see first what's going on in your community. The testing has to be your eyes. So, in my perfect world, Brittany, your top, players economically, your top health officials locally, Tazewell County has top of all those, bring them all to the table, and stay 6 feet apart, of course. But then seriously, work out those details for your region.
Right.
So that's how I would answer it. I don't know what Carla and Tara think, but that's what I think.
I fully agree.
Yeah.
Yeah.
Well said.
Yeah. Very well said.
Okay. Are there any, Kelsey, are there any more questions or comments?
Yes, we did have one other comment from Aaron Brown, who shared, it's also important that we note that we who aren't incarcerated and aren't in care facilities aren't more important than those who are.
Absolutely.
Oh, absolutely.
Yeah, that's a very
good point.
Very kind.
So thank you both for your comments and questions on Facebook. Again, if you have other things that you'd like to share or ask our panel, feel free to continue commenting on our Facebook page there.
Yep. All right, I'm gonna wrap it up and say thank you everyone for listening today or watching, and remind everyone how important it is to elect people to make decisions about our services who ask good questions, and people who can bring a variety of life skills and ways of looking at things to the table. And I do want to bring everyone's attention to a few bills that have been introduced in this legislative session that pertain to our healthcare. Back in January, before the pandemic, in Springfield, Andy Maynard filed a bill to address telehealth services, making sure that insurance will cover the needs and not force people to substitute in-person care when that is required. Don Harmon introduced a bill for the Nursing Homes Reform Act to ensure that Medicaid payments are sent on time. Sarah Feigenholtz introduced the Community Mental Health Reform Act. And the most exciting one is from State Representative Mary Flowers, introduced the Illinois Medicare for All Healthcare Act. Now, that bill is currently in the Rules Committee, where one of my friends today said, well, that's where bills go to die. We don't know what's going to happen. We don't, when I go to the legislative website, I see that things have, they're still working. So committees are still working, but we don't know if they're going to, if or when they're going to come together and vote on any of these big things. But I do want to remind everyone that Massachusetts passed healthcare reform ahead of the federal government in 2006, and they tried to provide healthcare to all residents. And I think Illinois can be a healthcare leader too, if we all get on board, and if the public demands it, of our elected officials, then we should be able to figure out a way to do it. We have the power to make change right here, right now, if we elect people who will truly serve the people and listen to the people. So thank you again for joining us. And I'll ask one more time if there's any more questions that popped up before we say goodnight.
Yes, we did have one more question, sort of a follow-up, this time from Kara Brown. Where would you imagine the essential workers in the conversation about reopening? For example, servers, gas station attendants, big box floor workers, and so on.
Right.
I think what Paul said earlier, I mean, he mentioned that, you know, there are a lot of people out there that are working face-to-face with people every day. And there are probably more jobs than we can imagine sitting here, you know, talking about it. It's going to be important at some time to know whether or not you have antibodies built up against
Right.
COVID, if there is truly immunity, you know, provided by that. When we get vaccinations, when that is something that's going to be offered to us, it'll be important that everybody get their vaccination. But like what Paul had mentioned earlier, all the different business leaders coming to the table and representing for their people, the people in their stores and their restaurants and their businesses, because they're going to know more intimately the details of the jobs that are provided by their companies, you know, and what interacting with the healthcare workers, the medical people that are at the table as well, in order to decide who gets who gets tested and how often, and when are those tests going to be needed, and when are they going to be provided to people.
I agree with everything Tara's saying. I just want to add to it that there's a learning curve and things take time. It was very disturbing for me to, even a week or so ago, go to a Walmart and see workers not wearing masks. And now I just read today that it's been mandated, that Walmart now has a policy, it's mandatory to wear a mask. So it's like, wow, finally. I have a niece who was a manager of a Walmart in Iowa. I'm like, I wish she was wearing a mask like 5 weeks ago. Do you know what I'm saying? So, they're coming on board. But I feel for this person, whoever asked this question, because we want the essential workers back now. We wanted them back a week ago, right? But we want them to be safe, and their health and safety come first. The gloves, the mask, it's just tough that things take time and there's not enough PPE out there.
Right.
I don't know what Carla thinks, but
I completely agree. We need to be able to keep everybody safe. That's why we need broad testing. We need the infrastructure for the testing. We need the contact tracing before we can open up much more than what we are now.
So there was a follow-up to that conversation. Erin said, understood, Tara. I think Kara, the original asker, wanted to know where you imagine the actual workers fitting into that conversation right now.
The conversation about healthcare, or the conversation about being protected when you go back to work?
I think probably the conversation about reopening our state in general.
Well, I was heartened to see that the airlines are starting to get on board with wearing masks. I mean, they're rebreathing the same air in a confined space. And, we've all been on, really crowded planes. So anything that they do is going to be an improvement. But essential workers, I think they need to be comfortable that the people that they work with and themselves, that they themselves are COVID-free or have the antibodies, so that and it's no different in nursing. Those frontline workers, some of them that have had the disease have been so relieved when they're finally healthy enough they can go back and they don't have to worry about it, or they, you know, we think they don't have to worry about
We
it.
hope.
So
Yeah.
Hope, yeah.
but I think that all the essential workers, from whatever field or, you know, area that they're working, need to have confidence and need to feel safe and secure in their jobs. And hopefully we do get a robust enough testing, you know, program available to us all, so that they can go back and feel that confidence.
And Kara, sorry, the Facebook Live feed is just a slight delay behind us. No, she did chime in. Yes, it was about reopening. She said, Kara, you were thinking about a sit down with community economic leaders and healthcare workers. And Kara was wondering where the floor workers would be in that vision.
In a community conversation?
Yes, I think she was referring to Tara's earlier comments. Yeah.
Okay.
Yeah, I think they need to be right there at the table.
Absolutely.
Or their representatives, you know, whoever can speak out for everyone, and is on the same page. Yeah, everybody that's impacted by this should have a place at a table where decisions are being made.
Exactly. Yeah, that's one of the reasons I'm running, and one of the things I'm trying to bring to this district is listening to everybody,
right?
And not just, you know, discounting or disregarding people that are traditionally, you know, at the what may have been perceived to have been, you know, at the bottom of the food chain, as it were. I mean, I'm just saying this now, bottom of the food chain. They are the food chain. Our people who are, you know, making minimum wage or barely over minimum wage are serving us our food or selling us our food at our grocery stores, and we need to have them at the table. We need to listen to what life is like for them. We need to listen to how hard it is to live on that wage. We need to listen to the fact that they don't have paid sick days. I want somebody who's serving me my food to have paid sick days. I don't care if you work at McDonald's or at a fancy restaurant. I want you to have paid sick days, because I don't want you serving me my food if you're going to cough and sneeze on it on the way to my table.
Yes.
You know? And as a society, we should take better care of people.
Absolutely.
Well, as a proud Democrat, healthcare is a right. It's not a privilege. And I can't believe anyone would think that healthcare is anything but a right.
Agreed.
Were there any more comments or questions?
Just some engaging back and forth on your guys' last comments. Yes, they need their voices heard now about reopening here and now.
Yes.
And thank you. They were said. I was hoping you would say that. So
great. Okay, well, if there's no more actual questions or comments that we should address, then I'll say thank you again for those who chose to tune in this evening. And if you're watching later, I'm sure you can. I know, Kelsey, you can put my information up, and I'm sure that I know Paul has a Facebook page. I don't know if Tara, do you have a campaign page yet? Not yet.
I don't. Next on my agenda, though.
Yep. Well, county board, to be fair, the election is not until November 3rd, and county board candidates have a lot fewer voters that they're trying to reach. But I'm sure that if you are looking at this a few months down the line, that you'll very easily be able to find Paul Resnick and Tara McKinley, and there's my information. And email me, send me a Facebook message. I'm very quick with the Facebook messages, a little slower with the email, but you can reach me, you can ask me a question, give me ideas for town halls. What are you interested in having conversations about? What other, do you want to hear from different experts in whatever it is that affects your personal life? What do you want to talk about? Let me know what you want to talk about. Let me know what affects you, how life is for you, and how you would like your life in Central Illinois to be better. So thank you, everyone, and thank you, Kelsey, for handling our technology. And I'll say good night.
Thank you, Carla. Thank you, Tara. Thanks, Kelsey.
Yeah. Thank you all as
have a
well.
good night.
That was good.
Very nice.
You too.